Hello, my name is Daniel. I'm a Master of Optometry student here at the University of Canberra. My research group and I are working on a project that will compare two advanced meibography devices, Lumibird's transillumination system and the Medmont Meridia red system, to determine which one more effectively detects meibomian gland dropout, a hallmark of dry eye disease. Dry eye disease affects millions worldwide, reducing visual comfort and quality of life. One major cause is meibomian gland dysfunction, where the oil glands in our eyes become blocked or atrophied. Meibography allows clinicians to visualize these glands and detect structural loss early. However, there's no clear evidence on which imaging system provides more clinically useful results in younger adults, especially when comparing devices with different technologies and analysis capabilities. Current literature strongly supports infrared meibography as a standard method for assessing meibomian gland morphology, and most studies rely on simple grading systems like meiboscore or meiboscale. However, few studies have incorporated a more detailed grading approach, like meibograde, which can assess early structural changes such as gland shortening and distortion. Importantly, no published research has directly compared infrared and transillumination-based imaging systems using this more nuanced grading. This reveals a clear gap in the literature and an opportunity to identify whether one modality provides better visualization or diagnostic precision in evaluating gland morphology. Therefore, our research question is, which device, Lumibird's transillumination system or the Medmont Meridia platform, provides more effective detection of meibomian gland dropout in adults aged 18 to 45. This will be a cross-sectional observational study with 40 participants who are both asymptomatic or symptomatic, and each participant will complete a series of information gathering pre-tests, having their eyelids lowered and imaged on both devices within a single session. The images will be graded using the meibograde, and a trained grader will assess the images independently, compiling the grading data to then statistically compare detection rates and severity scores between two devices. Our data will come directly from clinical measurements, and they will all be collected at the University of Canberra Optometry Clinic. All data will be de-identified and stored securely. Meibograde scores from each technique will be compared using analysis of variance with a 95% confidence interval, and symptom scores and osmolarity readings will also be compared to the imaging results using non-parametric tests, helping us explore relationships between structure and symptoms. The study will run over 12 weeks, starting August 2025, with recruitment followed by data collection through to October, and analysis and reporting within the month of November. The study has UC Human Research Ethics Committee approval, procedures are safe, minimally invasive, and equipment will be disinfected between participants. Participation is also voluntary, and withdrawal is allowed at any time without penalty. We expect to identify which device offers a clearer, more clinically useful image for detecting early gland changes, with the hope that these findings could guide optometrists and clinics in choosing the most effective diagnostic tools, leading to earlier detection, more tailored treatments, and improved patient outcomes in dry eye management. Thank you for your time.